Hello there. Good afternoon. Welcome to today's webinar, which is Winning Strategies for Reducing Work Comp Expenses. My name is Holly Foxworth. I'm one of the registered nurses. I'm also the Marketing Communications Director here at Axiom, and I'm so glad that you guys are here and that you've joined us today. But I will say that if you've ever seen one of those injuries that seem really minor in the beginning, but then all of a sudden it starts to quietly turn into something that's much bigger, much more expensive than anybody ever anticipated, you definitely came to the right place. That is exactly what we're going to be talking about today. Unfortunately, that's happening far too often, but the good news is that we're definitely going to be talking about why that's happening, and then also, more importantly, how it is that you can prevent that. So we're looking forward to getting into all the great content today. We do have a fantastic panel that's joining us. We do have a new face that's here. We have Dr. Cherry, obviously. He's our Chief Medical Officer. He's going to walk us through the critical role of early intervention. We have Dara Wheeler, our Chief Marketing Officer, and she's going to explain how the structure and communication can really drive down those costs. And then we have Marci, and Marci, if I murder your last name, tell me. De Vries, is that right?
De Vries.
De Vries. And Marci is a private investigator, but she's also the founder of Fraud Sniffr. And so she's going to be talking to us about how it is, what fraud really looks like in work comp, and then how it is that you guys can detect that early. She was telling us some stories before we joined, and they were fantastic. I think you're really going to enjoy hearing what she has to say. It'll blow your mind. Now, before we dive into some of this, let's go ahead and look at what it is that we have on our screen. So there on the top right-hand side of your screen, you're going to see a blue navy box. And so that is your ticket to next month's webinar, which is going to be on August the 14th at 1:00 p.m. And that one it's called Sync with a Y or Sync with an I, and what safety has to do to align with ops to be able to avoid some of those critical mistakes. So if you've ever wondered what's working well with other organizations, or, I wish I had some ideas that I could implement within my own facility that somebody's already started and we know that they work, this is going to be a great opportunity for you. We have Lauren Morris, who is our major account strategy leader, and so she's going to be joining the panel as well. She leads some of the largest accounts that we have, and so she's extremely knowledgeable. She's going to share what her clients are doing right now to be able to bridge that gap. So you definitely don't want to miss that. All you have to do to get signed up for that is just press that RSVP button. That will immediately get you signed up and send you a calendar invite. There's nothing else in addition that you're going to need to sign up for. So we definitely would love to see you there for that event, and that is how you get signed up. Secondly, we are going to be traveling to Orlando, Florida within the next 2 weeks. We're going to be there for Safety 25, which is ASSP. So we'll be there the 22nd through the 24th of July. And we actually have Dr. Cherry that's going to be speaking on the expo floor. He's doing a flash session on fatigue. So if you would like to attend that and you don't already have a ticket, we do have some free tickets for you guys that cover all 3 days. So if you'd like to drop your name right there in the chat box down there at the bottom, then we'll make for sure that we get you a free pass right after this event. Now, if you like gifts, I will let you in on a little secret that these webinars, we intend for them to be conversations and not that we want to lecture or preach to you. So meaning that we want to communicate directly with you and we want you to communicate directly with us. So if you have anything that you want to share, if you have a question at any point, if you have something that's happened at your own facility, if you have a claim that went way off the rails and you want to share it with everybody else, or you had some type of fraud, definitely drop those comments there in that chat box, since that's the first place that I go whenever I'm looking to send some of these thank you notes and gifts out after the event. So definitely make sure that you know where that is located, because you'll need it. We have some polls that are coming up as well, so we'll be sending some gifts for those. So make sure you know where that is. All right, and then lastly, we do have some additional resources that are there at the bottom of your screen. There's all the information for Fraud Sniffr. There's also a copy of our slide deck for today. So if you want to download that, you're more than welcome to. And then if you miss something, don't worry. We will definitely send out the recording it's usually 24 hours after these wrap up. So you can share with everyone else if you would like to. So let's go ahead and meet our panelists. Dr. Cherry, I'm going to start with you. I'll let you go first, followed by Dara, and then Marci last.
Well, thanks, Holly, and it's great to be with you guys today. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting the U.S. military, government, industrial, and corporate operations for the past 15 to 20 years. And it's a pleasure to be with you today.
Fantastic. It's a pleasure to have you. Dara?
Good afternoon, everybody. My name is Dara Wheeler. I'm Axiom's Chief Marketing Officer, and today is my 19th anniversary with Axiom. So I've been doing this for a very long time, and I'm excited about this topic. Usually Axiom is very upstream from the investigation and fraud sniffing, but it is a fun topic. So I'm excited to have Marci join us today. So thank you, Marci. Go ahead.
Thank you. I'm Marci De Vries. I'm the CEO and co-founder of Fraud Sniffr. We've been doing fraud investigations in social media for about 13 years, and we have enjoyed every minute of it. This job never gets old.
I bet it doesn't. I can just imagine. We're really looking forward to those stories that you're going to share. Well, thank you all for joining us. We appreciate it. I know that you all have so much expertise that you're going to be able to share with our participants here. So now that we've met everybody, let's go ahead and talk through what it is that you're going to walk away with today, what it is that we're going to learn. So we're going to be talking through 3 areas. We call them the 3 Ps. So you have prevention. So that's how early intervention is going to impact your workers' comp cost and some of those injury outcomes. We're going to talk about precision. Dara's going to speak to us about that one. That one's how it is that you structure your program so that you can make for sure that you increase the communication and you can also revise that return to work process that you have. And then also the final P, which is protection. And that's Marci's section. She's going to be talking to us about what fraud is, what it looks like in work comp, how you can spot it, and then obviously how it is that you can detect it and prevent it. So we're excited for all of you guys to be here today, and we look forward to everything that we're going to be going through. Before I turn it over to Dr. Cherry, I would like to hear from you guys directly. We have a poll up there, and this is where this will be the first time that you're using that chat box that we talked about. So I'd like to know how it is that, what it is that you feel about this. What's your biggest challenge that you think is really driving those work comp costs up for you and your organization? Then we'll share what that common theme is. So do you feel like that it's the first one where it's like delayed or inconsistent injury reporting? Do you feel like that people aren't reporting on time, or that they're reporting late, or that you're notified in the very end when you should be notified in the beginning? That would be what the first one would be. The second would be overtreatment or unnecessary treatment. So that is if are you seeing physicians that are writing those just in case prescriptions, for antibiotics, or are you seeing that they're writing out weeks of physical therapy that aren't really warranted? And then finally, the third would be, do you suspect that you may have some fraud that could be going on within your organization? And that could be past or current. So let us know what it is that you think. Oh, wow. There's some great answers. Exaggerated claims, overtreatment, delayed injuries. Yes, lots of overtreatment. Seems like that one is a big one. Dr. Cherry, I think that rings right with what it is that we were coming to you first with, but we wanted to talk to you about prevention. And so I will say, we wanted to get your thoughts on how it is that you can look at the process and how that's going to impact what your ultimate outcome will be and what that's going to cost. So I am going to have you go ahead and take it over and talk to us about what that looks like.
Well, thanks, Holly. And, I think talking about a process is absolutely critical to start off with injury management. And so in many ways, your process is the most important thing to have created before an injury before a company has sustained an injury. And you really can have a thought process by which, if an injury doesn't follow this process, if something goes awry anywhere in that process, it's at least one red flag, maybe more. And the more red flags you get, the more concerning you get about secondary gain, a lot of things that we do worry about. I would say it's probably the minority of injuries, but they get the most attention. And we want to really focus on, good medicine is good business, and we definitely want to not support fraud. So, and Axiom is really in a great seat because we're doing one-on-one case management, but for over the last 25 years, we've done tens of thousands, maybe 100,000 cases. So we have a great population health approach to seeing what's happening in the aggregate. And so I'll be talking about 3 scenarios that essentially is the same injury, but because not following the same process, are dramatically different. And so when you look at prevention or preventive medicine, there's really a spectrum of prevention. And so primary prevention is actually preventing an injury. Prevention is really what I think of as early or subclinical or very mild symptoms or mild disease. And then you have tertiary prevention, which is kind of full blown. It's kind of gotten so bad, you have to go see a doctor or you have to engage the medical care. And so when we think of, so now I'm just going to focus this on an injury. And one of the most common injuries in work-related and non-work related are a low back injury. And so let's maybe go to the next slide, and we'll talk about 3 scenarios based on kind of when the injury was reported and the type of medical services that we're seeing. But you can see a huge range of outcomes from a relatively low cost to a cost that can be 10 or 20 times higher. And then also the administrative categorization of the injury can really affect safety metrics, like keeping something at first aid versus lost work time, medical treatment beyond first aid, et cetera, et cetera. So, and I think this scenario right now is really the worst case scenario when it comes to how a relatively minor case can end up being, how would I describe it? It would basically be a worst case scenario in the sense of lost work time, high expense costs. It's a lose-lose scenario. Here at Axiom, we try to look for a win-win scenario where you get the right care at the right time and have the optimum outcome. So, so this one, again, is the injury that you never saw coming. So this is absolutely devastating, I think, for safety HR programs, because the company never really could assist the injured employee. And so, again, a minor back strain, theoretically, that happens near the end of the week. But, there's not a strong process or a strong safety culture that reinforces early or timely reporting. So this injury, although it occurred on a Thursday, the employee decided, it's minor, let me not, engage the process. But sadly, what happened is over the weekend, this festered because they didn't seek care, they didn't engage the process, so they didn't feel supported. And something that I'll point out too with each of these scenarios is when we think of an injury, we think of the physical injury, which is absolutely part of it. But as we've really engaged more into the psychological aspects of injury care, and then there's also a social aspect of injury. This scenario specifically, the injured employee is not gaining the care they need from a psychological support. So, say you have a minor back injury, you don't seek care. Over the weekend, it's festering. You haven't changed your activity. You've maybe even done activities that are going to exacerbate it because the employee is not a medical expert themselves. So by the time the weekend was near ending, the employee decided, I better get this checked out. Things are getting really bad. And they end up going to kind of the wrong resource. The emergency room is really for emergencies. So ER docs and ER providers are really there to take care of life-threatening emergencies. So they're very quickly triaging these things and looking for life-threatening injuries. And if you don't have one, you may have an extended wait, which can actually psychologically negatively impact your injury while you're waiting for hours and hours. The cost is very, very high, whether the employee pays for it, health insurance, but usually a workers' comp claim will be filed, and it'll be a very costly one as well. And then because ER docs many times are not going to deal with the nuance of OSHA recordability, medical treatment beyond first aid rules. They tend to maybe be a little bit aggressive when it comes to treatment protocols, and then even work restrictions. So by the time Monday morning, comes around, the employee usually will have a doctor's note that says unable to return to work for several days. And then usually we'll have some imaging, medications that are prescribed. And so this can quickly move to a lost time case, very costly. And so one of the biggest things we see from the tens of thousands of cases we do over the years is that time to report the incident is absolutely critical for the best outcome of that injury. And so costs really spiral from that. The workers' comp system sometimes can be very slow, and it actually kind of almost prevents the healing process. So this, again, is kind of the worst case scenario from that perspective.
Yeah, definitely. So just to kind of understand, you're saying then that maybe the employee was injured on a Thursday, they don't tell anybody at work, they don't tell their supervisor, they just go about their day, and then you're saying throughout the weekend they continue to feel discomfort, and then that is when they go to the ER on Sunday, correct?
Right. And what I've seen over the years is that a lot of times these are good employees not trying to scam the system, perhaps. So they're employing this stoic approach that I'll be fine. But then over time, psychologically, they start worrying about their injury, or if they share with a spouse or a friend, they say, well, you got injured at work. They got to take care of you. You need to go to the doctor now. But now it's the weekend. And so, again, you have the psychological and social impact doubling down on just the physiological impact. And a lot of the studies for workers' comp show that one of the biggest drivers for return to work or minimizing the impact of the injury is the psychological aspect, when the person feels like they have been taken care of. So this is really important. So even good employees can succumb to not following a process if they feel like it's better to be more stoic and not non-responsive to an injury.
Yeah, definitely. Talk to us then about the second one. So that one looks like that maybe it was reported a little bit late. It's not quite as late as what the first example was, where it was not reported at all, but definitely a little bit later than that. And it seems like that there's still quite a significant cost that's associated with that one.
Correct. So really having the same injury of a low back that, doesn't necessarily prevent the person from doing activities of daily living, but instead of reporting it immediately, they wait until a day or so. So there's still a loss of opportunity to slow down the injury or start the healing process. And again, that's the physiologic, the psychological, and then the social components of the injury. And so by then, the problem was a little bit worse than the day before. So they go to a clinic, also diagnosed with a low back sprain, and prescribed, ibuprofen, but at prescription strength. So it's medical treatment beyond first aid. And because it's fairly, painful for them and a little bit of limitations, they end up getting physical therapy for 2 weeks. And so because of this delay in reporting, there's this over-treatment, there's usually a workers' comp claim, and then lost productivity, and certainly OSHA recordability. And again, because we see, thousands or tens of thousands of these types of cases, we know kind of within a certain confidence that these can be handled at first aid with really no lost work time. And so we really want to reinforce timely reporting. So, a day is better than a week, but an hour is way better than waiting a day, and it seems very elementary and very simple, but it's absolutely critical.
Mm-hmm. So if they were able to report that within the hour, if they follow what the process, what we're saying that process would look like, what ultimately would occur then?
Correct. So like say within, 10, 15 minutes, but definitely within an hour, if they can get some medical advice regarding what, first an assessment of, their past medical history too, to make sure there's nothing else going on. But once that's all kind of taken care of, getting some really first aid recommendations, some advisement about what to expect. That's really the psychological component. Sometimes the next, the injury is not too bad, but the next day you're a lot worse than when it happened. So psychologically you're concerned. So if you get that reassurance right away, you get some first aid and some guidance on kind of the overall picture, as well as you can always follow up whenever you need to as well. We will follow up with you kind of based on the nature of the complaint. But that really provides a lot of psychological reassurance, which actually really helps the physiological healing. And it also helps let the social aspect of the injury, where the family's not so concerned because the employee is taken care of and they can get access whenever they need. And so here, really, this the large proportion of these types of injuries can be kept at first aid, where there's no lost work time. The cost can be 1/10 or 1/20 of the price of an ER visit, and probably 1/5 the cost of a clinic visit. So it's super efficient it's the win-win, we call it, where the employee doesn't even have to leave work. They feel reassured. They have support 24/7 whenever they need it.
Yeah. So if we compared those, then if we did the comparison where we're showing then the difference, what do you see? What immediately jumps out at you whenever you compare the three scenarios?
Right. And really the most important thing is the employee is taken care of, right? So their physiologic injury is taken care of, and minimizing the psychological and social impact to them, right? And so they're often way better medically, but also the outcome for the company is a win-win in the sense of there's no lost work time, there's no OSHA recordability, and the cost can be a fraction of what it would be at a clinic or definitely at the emergency room.
Yeah, definitely. There were some great stories that have came in, Dr. Cherry. We have some that there was one that said that they were seeing employees, that they were seeing a trend of employees and individuals that were seeking a physician once a month and extending their recovery time out. I saw one where they were talking about that there was a manager who had applied for an ops role. They were not given the position, and then suddenly they had a work comp claim the next day after that. Marci, yes. I'm sure this has sounded very familiar to you.
Very familiar.
Yeah. Let's see. It looks like that there's also some concern about personal claims being ended up as work related, but lots of experience that people are having with this. And so clearly it's an issue that everyone's experienced on a larger scale. Well, let's transition then to the second part of that, which is going to be that precision that we talked about. And Dara, I'll come to you for that one. But talk to us about where that comes into play, and then what that looks like in real life.
Yeah, great. And thank you all for submitting some of these scenarios that you've gone through. And I know we'll get to some of that. And when we think about best practice and precision and all of this, making sure that you have a systemic approach to all of these different programs. And I know a lot of you work in different departments or different roles. And so thinking about this cross-functional role of how we address injuries in the workplace, and Scott made a great point that it's not always physical, it could be mental health components as well, that if you build a system that makes it an intentional program of how you report, how you manage, how you support, employees throughout this experience, from that first call all the way through return to work, that's where the dollars come into place. So when you think about the way, I mean, I know we're using Axiom as an example a lot, but in examples of any sort of systemic program in managing injuries, the best thing you can do is communicate across the entire scenario, make sure employees feel cared for, make sure that they hear from the business that there is a way to manage this. And first, like Scott said, prevent, manage, and then care. And if we do that well, if any company puts these systems into place and the care is obvious, the downstream costs are handled because everything is managed either from a primary prevention standpoint or from a or early intervention component. So the comp costs that then spiral potentially downstream aren't usually because of what the nature of the injury was itself, but because of breakdowns along the system. So if, and Scott uses these as examples a lot, it's keeping the small things small. So making sure that if it is a relatively minor injury, that stays relatively minor and is contained, and that employee is helped early, and it doesn't become something that gets exacerbated or has challenges later in the case. So just as a recap, making sure that the cross-functional communication, that systems are consistent, and these are levers that you can pull to reduce cost, but it is that that cross-functional system approach that makes sure that employees and then teams and departments are managing this well.
For sure. Brandon, you're exactly right. Return to work and best practice case management. That's exactly where you need to be. The other thing I was going to mention too was you were talking about communication, and it made me think about, at our summit that we had this year, one of the presenters was talking about how they had changed their metrics, or they had changed what it is that they are tracking in terms of, in the past, there have been organizations that maybe were tracking or they paid bonuses based on, no injuries or no report of injuries or things like that. One of the presentations that they gave were talking about how that they changed that criteria. And so they actually are paying bonuses to their staff on, are they reporting within that first hour? Are they doing near miss reports? And so it just completely changed the culture. They not only had an excellent result, but it completely changed the culture of what was going on there. And people felt like it was safe to report the injury. And because they reported it immediately, then obviously then they didn't have the snowball effect. But I thought that was a great example that they had implemented on how it is that you can kind of, turn that in a different direction.
Yeah, absolutely. The measuring of this and the unintended consequences of how you measure is really important to think about. And one of those same clients that was talking about it also did a whole thing where they have a wall of faces. And what they do is they have employees bring pictures of their family and their why, and they put that up. And that's a visual reminder for everybody that these are human beings that want to go home every day to their families, that care about them and rely on them. And yeah, the interesting thing, and Scott mentioned this as well, in the years and years of data and doing this at a population level, what we find is that the more safe and psychologically comfortable people feel reporting, the safer the business gets. And so sometimes that feels counterintuitive. When you ask people to report and you incentivize the reporting of injuries quickly across the business, the whole business becomes actually more safe, and the severity of injuries reduce, the time away with injuries. All of the beneficial metrics reduce because people start pointing out near misses, they start pointing out things, and the whole group becomes invested in making sure that everybody is safe. And so that becomes a really interesting phenomena that we see over and over again. And one last note about return to work planning, and I know a few of you mentioned that you don't need return to work planning if they're not off work in the first place. And
Amen.
So anything you can do to keep people healthy and whole on the front end is really great. And I know some of you have mentioned things like there's not restricted or light duty available, and that gets really challenging to manage when you're dealing with injuries. But prevention and early intervention then become even more valuable to businesses, because you really do then prevent the downstream issues of replacement of employees and productivity losses from people out of work. So
absolutely, yeah. Lisa, I love what you added about, Lisa shared that they've actually done that at their organization about their My Why. So I love seeing that. That's fantastic. We'd love to see any pictures that you wanted to send. We'd love to share those with everybody else too. I'd love to see those. Well, Dara, talk to us then about if we bring this to life and we talk about what this would look like, how it is that you maybe could implement that, and then what the outcomes would be. Give us a real life scenario.
Our buddies at Arxis, they have been with Axiom for just a little over a year. And we have a lot of stories like this. And I know a lot of you have asked for some of the specific scenarios and stories. We will share everything we can. I know Arxis, their CHRO, is very passionate about this. He joined us on our last webinar as well. And if you are ever interested in finding out how they did it, he is always an open book and willing to discuss. And I will say one really, really critical thing they did in running and implementing this program was it was a top-down program, CEO all the way down. Every injury had an after-action review with the CEO, and he really made sure that everybody understood that they care. And they're in a really challenging industry in building construction, and that can sometimes be one of those industries that mental health and physical health get a little bit pushed to the side in the way the culture exists. This company was struggling to get insured at all and covered even at all by insurance because of their issues with injury outcomes and claims costs. They, within less than a year of implementing Axiom, saw 91% reduction in claims, 59% less recordables, and they are projecting about a 30% work comp premium reduction within 11 months. But what's really important to us, and numbers are great, you know, everybody cares at the end of the day about numbers, but these are all people that are feeling safer at work and more supported by their organization. And that has also led to more mental health and psychological safety cultural shifts within the company. So we care about the numbers, but we care about the people. And by doing that, this company has really seen a big shift in their work comp dollars. So it's been a really great partnership for us to experience. But like I said, if anybody wants resources, and we'll talk more about the how behind how to do this.
Mm-hmm. Yeah, that's an excellent example. I love whenever we get to talk about them because they did such an amazing job. And it's really powerful to see if you just put one process in place that addresses things from the very beginning, you see what a significant difference that immediately has and the impact that it has on the organization. Thank you, Dara. Well, let's go on to Marci, and let's talk about our third pillar, which is the protection piece of this. And so Marci, what exactly is it? What does some of this fraud look like? And what type of fraud are you seeing? Is this a huge problem? What would you say about that?
Right. So, I mean, it impacts companies to the tune of about $30 billion a year. And that's been well documented. I think that that's a lot of the reason why we have 143 people on this webinar right now. Nobody starts out with an injury claim really thinking that they're going to have a fraud. Either they have had conversations while they're on a workers' comp claim with an attorney or with friends who tell them to elongate it, or they get used to having checks and there's not a real stringent return to work emphasis at the company, something, right? Somehow they go from being injured to being permanently disabled, and then that becomes fraud. There are some instances of immediate outright fraud where someone reports a claim on Monday, like Scott gave those two great examples in the beginning of the webinar where their injury is just not reported for months or it's reported 4 days late. During that time, they can have a different injury. We had an example for one of our self-insureds where they had a Monday morning injury, and we looked at their social media, and lo and behold, they twisted their ankle playing basketball on Saturday. And because they twisted their ankle during basketball on Saturday and reported a twisted ankle on Monday and said it was work, I mean, that's obviously fraud. Again, probably not something that they were trying to do dishonestly. They just thought maybe they could get this injury paid for by work, which, I mean, everyone's heart is in the right place. I mean, we're not in the business of, pointing fingers and making people look bad, but sometimes they just don't understand the rules, and it's important that everybody's playing by the rules. Mm-hmm. So we, a lot of times we just help point that out.
Absolutely. And then, whenever we talk about some of the things that you have seen, what would you say would be some of these red flags that employers would want to be looking for that you're seeing on your end?
Yeah, so you definitely, if you have a frequent flyer, this is someone who's getting hurt at work all the time. You'd want to get social media on that person and then just keep updating it over and over and over again. Maybe send out some physical surveillance if they have a really big injury as a frequent flyer. Anytime there's a mental component to it where they're having anxiety because of their injury, we're probably going to want to check out their socials, because it's really easy to see if someone's living their best life on social media. They're, posting great times with their family, or, they're posting that they're crying all the time and can't leave their house. Either way, whether we document the actual injury with a report, or we document that they're not actually as injured as they're reporting to their workers' comp official, it's important to know either way. Anytime there's neurological, like a lot of TBIs will be over-reported, or sometimes accurately reported. We just want to know. Like, the whole point of doing an investigation is to make sure that we know. We also want to make sure that as we get close to your policy limits, or if your injury is exceeding policy limits, you definitely want to start getting an investigation going on that person. And, go back not just to the date of injury, but before, so that you can get an activity baseline. If this person was a couch potato before their injury, and then they're injured, and we're looking at, getting them back to baseline, all we have to do is get them back to being a couch potato again. And sometimes that's easier than it sounds, right? The other thing we want to do, if there's a long lag between the injury and the report of injury, is we want to get a social media on there, because sometimes there's an intervening incident. A lot of times we'll see that they were in a car accident between the day of their injury and the day that they report the injury. Or they were wrestling with their brother, or they, conked their head because they were too drunk, last Saturday. It could be anything. We just want to know.
Yeah. Before we get to the last one, I will say that we've got it open. So if you guys have any scenarios that you want us to solve for you, or talk through, you can go ahead and put those in the chat, and we will get to those after Marci finishes up. But Marci, what I did want to ask was if you would tell us like some real live examples of things that you've experienced, and the impact maybe that your organization has had on some of these types of scenarios.
Yeah, 100%. I see a question in the chat. Do you mind if I answer that one first?
Yeah, go ahead. Yeah.
Okay, I see a question that says, do the insurance company do social media investigations? We work with insurance companies, but also with TPAs. So if you have a TPA as part of your insurance program, you can do special handling instructions that say, at this point in the progression of the claim, we would like to have you start a social media investigation, either with the in-house, at the TPA, or with Fraud Sniffr, or whoever your favorite investigation company is. You can do it direct. If you don't have a TPA, you can do it direct through your carrier, or you can just have us do one for you on your behalf. We'll work with anybody.
Gotcha. Yeah.
Yeah.
Talk to us about some of the stories then that you guys have seen.
Yeah, so this picture you see here is not the real picture of the claimant, but we had someone who was in New Jersey going for perm total. And for those of you who are not in New Jersey, A perm total loss means we have to pay your salary for the rest of your life, regardless of if you recover, because you were so injured in the past, which is a great tool for people in New Jersey who are injured. It's very fair for people who are grievously injured. This fella, while he was pursuing his perm total loss, moved to South America, started mining jewels and creating his own jewelry, which means he was doing, he was like moving stuff out of a mine with buckets and busting open rocks. And then he also had a side business building braid floats. So with one $600 report, this guy had his perm total dismissed with prejudice. He was permanently deported, and he had also sought Medicaid for financial assistance because of his grievous injury. He lost that and then was sued for fraud over on that side. It just caused total chaos in this guy's life. But if he would have been telling the truth in the first place, there's nothing to lose.
I would imagine that would be a significant claim if it was something that they were going to have to pay out for the entire duration of his life.
It was a $5 million claim.
Wow.
I have a question in the chat that says, is it hard to prove fraud after a claim closes? We can do it. You can examine for fraud at any time. If you're seeking damages back to your company, if you want to sue that person, you definitely can do it after the claim closes, because the data trails are probably still in social media. They're probably everywhere. So whenever you want to pursue it would be when you can pursue it.
Mm-hmm. Marci, there was another one that came in. It was, Teresa was saying that they had a 72-year-old lady who fell in July of 2024, had pain in the knee, had arthritis in the knee. They're still continuing medical treatment. 2 weeks ago, the doctor put her on 2 weeks to rest the knee. This is almost a year after the injury, and was asking, could this be fraud?
So in a case like this, it's probably not as black and white as fraud, not fraud. But what you can see is when she's not at the doctor, what does her life look like? And is she at baseline? That's really, again, we're trying to get back to baseline. Maybe she is still injured, and maybe she's using a cane and really talking a bad story at the doctor. But then you'll see her going and climbing to the top of the bleachers to watch her kid or her grandkid play baseball. Let's just check it out.
Absolutely. Dr. Sherry, there was another one that had came in here that was asking you specifically, what about if they don't have restricted duty or light duty at their organization? How would you manage one of those scenarios?
Yeah, so in general, being as the employer should be try to be as flexible as possible. I get the sense that sometimes that's just not possible, but other times it's a cultural approach to where they're not wanting to accommodate, which has its downsides as well, and so it'll be different for every employer. But I think with if you're really trying to manage the variety of claims that or injuries that can come through, having that flexibility of different types of duty other than full duty is really powerful. I think what I've seen in the past is people are afraid to do that because people will start in light duty and then never progress. So you really want to have a policy that can slowly return to work or graduate to higher and higher duties. But there's pros and cons to both sides, really. So there's no perfect solution. But to be honest, what I've seen in my career is that sometimes there's reticence to engage and invest an investigator when coworkers have actually seen things on social media, or they know this person actually has a side business in the same industry. So I would say there is low hanging fruit, and then there's higher hanging fruit. And so you're not going to prevent all fraud. And then you actually are going to have some injuries that are going to be beyond first aid too. So the main thing is to be as efficient as possible to prevent, these red flags from coming through and not adhering to a process,
Yeah. And if your company doesn't have an RTW program, you can still look at them in social media and see if they are doing roofing for their nephew, because if they're doing roofing, they can probably go back to work.
Yeah.
Good point.
And that also is, I think, compelling for the physician, the treating physician of record, to where you can present that information documented, right? Like, even in my career, I've been presented with just work, potentially someone calling me, but it's like, we need this in writing. We need it documented, and having a professional service is really, I think, invaluable. And again, you want this whole process, right, fully fleshed out, because, and then once you have that process, you really need to be adherent to it for every claim,
Mm-hmm. Mm-hmm.
Yeah, consistency is good, because then you're not showing bias. If this would ever go to court and, you're only investigating, a couple people, when there are other people of different, let's say, ethnic groups that you haven't investigated for a similar outcome, consistency is totally key. Totally key. I saw there was a question in there about using someone like Fraud Sniffr in conjunction with your TPA. And if you hire us, and then, how do we share information with the TPA? If you want us to share information with the TPA, we definitely will. And if you don't, you don't have to. It's more of a, however the claim resolves most effectively for you, with the greatest benefit to your company.
Yeah. Here's a good one. Corey had said, when other employees see that someone else is on light duty on the yard, I've seen it make others want light duty as well, therefore drumming up an injury to do so. Dr. Cherry or Dara, have either one of you seen that scenario as well?
Yes, I and maybe that's a great component of your policy, is that there are kind of guardrails beginning where you can come into light duty, but there's a finality to it. And wherever you draw the line in your policy, whether it's no access to light duty, or there's always going to be festering around those goalposts, but you want it to make sense. But there's probably no perfect policy too. But one thing I wanted to just mention too is we talk about culture a lot, and I had to think about that in depth years ago. And I found a quick, we hear of pop culture and things like that, but when it comes to safety culture, what hit me strongly is automatic behavior. So, for a safety culture that does immediate reporting, it's like you don't even think about it, right? Because we all have different personalities. Some of us are hypersensitive and will show emotion or report injuries quickly, but others are stoic and not reporting. So you don't want that variation in your culture, right? You want automatic behavior,
Yeah. Here's one that came in, and this may be for you, Dr. Cherry, and Marci both, but they were asking, if you see someone on social media, such as roofing for their nephew, but the medical states that they have restrictions and limitations, do you have grounds to question the physician who made the recommendation?
I mean, do you mind if I go first, Scott?
No problem. Yeah.
The physician only has the information that was given to them by the claimant. So if the claimant is doing a very good job of looking super injured, I would leave the physician out of it, because, I mean, they know they're getting lied to all the time, but they don't have any other information. So conversely, and I think Scott actually said this earlier, if you have a good, compelling social media report, you can give that to the doctor before that appointment so that the doctor can encourage a return to work.
Yeah, so I totally agree. And I think also the value in that is, even if it doesn't change the doctor's opinion, I think it dramatically supports the case in the sense that the injured employee is not following doctor's orders. And so therefore, there is a loss of opportunity for healing, and it shows responsibility back to the employee for some of that. And I'm not an expert in the legal aspects of this, but I suspect that does devalue the claim, even if it doesn't necessarily have the claim rejected.
Good points. Another question: as an employer, are we allowed to say that we approve so many PT appointments? That may be asking, can they have some control over what the recommended PT appointments were?
Yeah, I think in general, it's probably best practice for the employer, especially if they don't have an internal medical department, to not manage care remotely, because that could be seen as potentially inappropriate. If you have an internal medical department, then you have providers butting heads, so it's a little bit more nuanced. But I think in general, you want to defer to the medical providers. And that's why I think having an investigation, if you have a red flagged case, or if it's just part of all your, claims, that it does help the provider with more a balanced approach with regard to the information.
There's one other aspect. If you suspect that there is a provider in your area who's just doing endless appointments and pill milling, you can have an investigation run by us on that doctor, and then you can present that to your carrier, who would then be able to move forward with some legal action against that doctor.
Wow.
Interesting. Yeah.
That reminds me, of don't you guys remember, several years ago where they had the big bust in Florida where, it was like a pill mill where they were producing, they were doing all of these. Have you seen that as well, Marci, and some of the things that you covered?
Well, yeah. I mean, the other thing I've seen is doctors' offices where when you search their address, the sign is pointing down to a basement and it's got graffiti all over it, and it's like just the nastiest office. It's really not a reputable, who would go there unless you're trying to get pills and extra treatment? So, sometimes it just winds up discrediting the doctor enough that when you go to mediation and you're handing, we call them table sliders. These are documents that are developed by your investigator that aren't necessarily legally, going to change anything, but you slide them across the table at your claimant or the plaintiff's counsel, and it's embarrassing enough that it just changes the trajectory of the conversation.
I'm sure it does. We did have a follow-up question that we were just talking about some of those PT appointments. There was a question saying, adding to this, in some states you can direct pay up to a certain dollar amount. Can we then say how many PT appointments? Did we lose Dr. Cherry? We may have just lost it. Are you there? We may have lost him.
Looks like he's lost. Yeah,
we may have lost him. Marci or Dara, either one of you want to take that one?
So that's outside of my purview. I'm sorry.
Dara, what are your thoughts? Or where would you
I think,
on that?
I don't know. I think you would need to either review policy or just make sure that you aren't tripping over state laws around employer-directed care. So you just have to be really careful about managing those state laws, and it can get very complicated. To Marci's point about physicians, also, because we do gather a lot of data on every case, we do track things like opioid prescriptions and at the doctor and clinic level. And I had a client having a review every quarter on any trends associated with doctors or clinics that were maybe inappropriately prescribing medications. And, for the most part, like Dr. Cherry and Marci both said, doctors are only doing what they can with the information in front of them, and they're usually doing the best with that information. And there are times where opioids are appropriate on occasion, but we do look at that information to make sure that that's why part of why you have somebody managing cases at the beginning to make sure that it is appropriate. And a lot of Dr. Cherry's time is spent, and it's not to necessarily dispute, like you said, no, you don't want medical practitioners disputing each other on these cases, but reviewing cases to make sure that everything, you know, all of the signs and symptoms and everything kind of match up to what the treatment plan was.
Yeah, just a little bit of maybe nuance about that is there's kind of this spectrum too of a case to where at some aspect over here there's, you know, frank and intentional fraud, and then on the other side it's a very quick and straightforward efficient injury case management. But in the middle there can be a gray area to where it's unclear if the mechanism of injury is medically plausible for that injury and for how that has manifested. And so we do spend a lot of time providing insight into our clients with regard to, you know, could this been handled better? Does the mechanism of injury make sense for the injury and all those things? So you kind of have this full spectrum across the board. And again, you want your policy to focus across all of that, right? Like you do want to be concerned about fraud, but, you know, I think there's value in across that whole continuum.
Mm-hmm. Yeah. There was a question about New Mexico. I don't know if anybody has any additional information that they want to add on that.
I do.
Okay, go ahead.
We can run, investigation firm can run an employment check, which basically pulls all the W-2 records from all the payroll providers across the country. So we would be able to tell you if that person had worked in New Mexico, if they were working on a, you know, on a W-2 basis.
Mm-hmm. Dara, I was going to ask you to, if you would maybe just kind of speak to how it is that you would avoid some of those, you know, why it is that or how it is that you're going to avoid some of those unnecessary prescriptions, and why that process is so important whenever you talk about, you know, moving care outside of just internally where it's first aid measures to an outside facility.
Yeah. So having somebody on your side, whether it's internal, like Dr. Cherry said, medical department, somebody on your side kind of managing injury cases or work-related cases from the beginning, and making sure that care is appropriate across the process is really important. So, I mean, really, even to Dr. Cherry's point about the MOI, the mechanism of injury, matching the treatment approach throughout the case is really critical. So making sure that somebody is being treated with the appropriate level of care is really important. So back to kind of full circle, an emergency room exists for a reason. And everything that's handled in an emergency room is assumed to be an emergency. And if you come into the kind of opposite mindset of everything is, you know, coming in relatively minor and should stay relatively minor, and differentiating between emergency and relatively minor first aid injury, making sure that across that spectrum, the treatment protocols are appropriate for every stage along that spectrum is really a critical partnership. So wherever you find that partnership internally, externally, that's really becomes the goal of an overall program that we've been discussing.
Yeah. I think we have time for one more question that was here. Marci, I see several that may be coming your way here, but I'll ask you, there was a question about what makes New Mexico different than something like Texas. And then there was also a question about California, your experience in California.
Yeah,
I knew that one would come up at some point.
California is a much more difficult and interesting area than the Midwest or the West. Sorry, I don't mean to discriminate, but I mean, if you've worked in California, you know what I'm talking about. So in California, the table sliders, as I mentioned earlier, these just sort of documents you can put across the table that don't cost anything. They're just part of your normal reporting that you would get from an investigator. Working on people's personal shame and personal ethics is really the only thing that works in California. The court system is designed to not work in your favor as an employer. So you want to try to really work on people's conscience and make sure that they know that you know what they've been up to. And in all jurisdictions across the country, there are people with no shame. We're hoping that some people in California who might be exaggerating their injuries or outright misrepresenting them, you know, once you are very clear with them that you understand that that's what they're doing, sometimes they give up. Or sometimes, you know, it provides an off-ramp where your next settlement offer can be one that will all of a sudden be acceptable.
Gotcha. All right. And any thoughts about the New Mexico, the difference between New Mexico and Texas? I know we're right here at time.
Yeah, I'm still not really sure what they're trying to get to with that one. From my perspective, New Mexico and Texas are the same. I don't know of any legislation that would make them different.
Awesome. Well, guys, I appreciate all three of you joining us. We appreciate all of you joining us. If you haven't already, make for sure that you click that register now button there at the top of your screen. And we look forward to having you next month when we talk about how it is that you can sync up safety and ops. So have a great day, and we appreciate your attendance.
Thank you, everyone.